Saint Lucia has recorded another case of COVID-19. The new case brings the total confirmed cases to 18. The news was disclosed by the Chief Medical Officer Dr. Sharon Belmar George on Sunday, May 2nd, 2020, after 52 samples were tested on Saturday, May 2nd, 2020. According to the CMO, the newest patient is a middle-aged man with no known travel history.
The individual is a 51-year-old male who sought care at one of the respiratory clinics with a dry cough but none of the other accompanying symptoms of COVID-19. He has no known travel history and we are in the process of investigating the source. The individual is currently in care within our respiratory hospital and is responding well to care. The Ministry of Health's contact tracing team is undertaking the necessary follow-up for the identification and quarantine of contacts of this case.
There has been an underground network between Saint Lucia and Martinique for years. For weeks, public officials have been expressing concern about the illegal entry of people into the country, especially across maritime borders. Now the spotlight has fallen on the porous east coast of Saint Lucia, which is replete with coves, cays and inland waterways.
The emergence of cases on the East Coast continues to be of concern to the Ministry of Health as we continue to receive reports of entry through unofficial channels. We continue to strengthen our surveillance in these areas and anticipate the detection of more cases as community testing increases. COVID-19 poses a risk of transmission to every individual irrespective of age, socioeconomic status or gender.
Public health officials are urging men to access the Ministry of Health's respiratory clinics. Historically, men have been hesitant to seek medical attention in the face of healthcare issues.
Data from the epidemiological department indicates the existing respiratory clinic services are largely being accessed by females. It is an established trend that men tend to be delayed in their seeking of clinical care, sometimes until the condition has advanced significantly. Our males are important segments of society, especially in their roles of spouses, fathers, breadwinners, leaders, and protectors. And as such, when our men are protective of their health choices, it benefits a large cross-section of our society. We particularly encourage men who may be feeling symptomatic to also seek care early, as this can prevent possible complications and allows for achieving better health outcomes.
The Ministry of Health notes that data trends for the region of the Americas and more specifically the Caribbean demonstrate continued increases in the number of cases of COVID-19. Officials say this development underscores the authorities' call for St. Lucians to maintain a level of vigilance as citizens are still at risk for COVID-19. St. Lucians are urged to comply with social distancing protocols, practice good hygiene, and utilize the 5 respiratory clinics and the 311 hotline. Joachim Duplessis, HDS News Force.